Hey guys, welcome back to the Medicare Masterclass. This time talking about lesson 2, which we're going over supplemental coverage. I mentioned in the last lesson that original Medicare is pretty good coverage for the most part, unless you have a catastrophic event, where if you have your worst year ever, you're responsible for your share of the costs, whatever they add up to be. So what we represent as insurance brokers and agents, and what private insurance companies have done, is they've created these supplemental options to help put a cap on those costs first and foremost. But it helps pick up that 20% you're normally responsible for, and you may get some additional benefits out of it as well. So I know you're probably seeing a lot of advertisements for the supplemental options. Do you go with a Medigap or Medicare Supplement plan or a Medicare Advantage plan? Do you need the drug coverage plan? And there's also other types of coverage you can get as well. We're going to dive in and basically lay everything out so you kind of know what is available to you and make an informed decision if it's a route that you need or want to go with. So we're going to start with talking with Medicare Supplements. These are a standardized set of plans that no matter where you go in the country or what company you go with, the coverage is exactly the same. There's no network. You can see anyone in the United States as long as they accept original Medicare. And, your premiums can vary, but they'll be based on your age, your health, and the company you go with as well. So the coverage is the same with every plan, no matter what company you go with, but your premium may change. So with these plans, they do take into account pre-existing conditions. They are not regulated by the same organizations as Medicare Advantage plans, or if you're familiar with Marketplace or Obamacare plans, they do take those into account, pre-existing conditions. So there's two words to consider. There is guaranteed issue, an open enrollment, and underwriting. So when you're first eligible for Medicare, you have an open enrollment period where you have a guaranteed issue right, which means the company is not going to ask you any health questions, and they'll take you regardless of what your health is. After that, you can actually change Medigap plans whenever you want, and certain states will have requirements when you can change and still have a guaranteed issue right, but generally you're going to be susceptible to underwriting, which means they're going to ask you an extensive list of health questions that if you answer yes to any of them, they're either going to deny you coverage because they're taking on too much risk with you, or they will rate your premium higher to compensate for that risk as well. So the reason why they do that, these are very comprehensive plans. So you can look at this chart here. These are all the Medigap plans that are available. Now, Plan F, you may be familiar with, but it is no longer available to those who turn 65 after January 1st of 2020. It is still available to those who turned 65 previous, though, so that's why it's still on this chart. And as you can see, it is 100% coverage, as long as Medicare covers the service. So it is really comprehensive coverage. The company is taking on a lot of risk. So the new Cadillac plan that most of my clients are on is the Plan G, where the only thing you're responsible for is the Part B deductible for that year, which again can range anywhere from $150 to $200 or higher, just depending on the year, and it can go up in the future as well. And once you pay that, then it pays 100% for the rest of the year, as long as Medicare covers the service. And so each of the Medigap plans will cover a little less than that and save you some premium. So this is the more expensive route, but it is the more comprehensive route. You have a lot of flexibility. Again, you can see anyone in the United States as long as they accept original Medicare. So, and I mentioned Plan F. Plan C, which is right here as well, is basically anything that involves having the Part B deductible paid for has gone away. So Plan F, Plan C, no longer available, but they are still available to those who turned 65 prior to 2020. Now, on to prescription drug plans, diving more into what that Part D is. So these are insurance policies that just cover prescriptions. They go on top of your Medicare Supplement plan because, fun fact, original Medicare and Medigap plans do not cover prescriptions by themselves. So you always have to get your Part D administered through a private insurance company. In this case, this is a standalone drug plan that you would have in addition to original Medicare or in addition to a Medigap plan. So every plan is different in drug coverage. We'll go into that more in the drug coverage lesson. But just know that they're all different. They have to cover a certain number of prescriptions in every therapeutic category, but they do not have to cover every prescription out there. So they rank them all differently, they cover them differently, and your copays can vary quite differently between plans as well. That's where we come in and we can help you narrow things down and find one that covers your prescriptions the best. Now we're going to talk about Medicare Advantage plans, or Part C. I like to think of Part C as complete because in this case, your Medicare is managed and administered through a private insurance company. And what they do is they take your Part A and B coverage, and they usually include the Part D drug coverage, put it all into one plan and call it Part C. So that's why I like to think of it as complete, because it's kind of the all-in-one package. Some things to note about the Medicare Advantage plans. Because your Medicare is managed through a private insurance company, you do need to use their network. So they are typically set up as HMO or PPO plans. HMO being health maintenance organization. You've got a network of doctors, specialists, hospitals. Some HMOs traditionally require referrals, but not all plans do anymore. But you need to stay in that network in order to receive coverage unless it's an emergency situation, in which you can go to an urgent care and emergency room worldwide. PPO plan, same thing. You still got that network, but you can go out of the network as long as you're willing to pay a higher copay or coinsurance as well. So it gives you a little more flexibility. And I know that sounds restricting compared to the Medigap plans. Yes, they are more restricting, but they actually are not as restricting as you traditionally might think a network plan would be. And it's hard to describe without actually showing you a plan, which I can't do here. But a lot of times plans can have national networks or travel coverage built into it that even you're on an HMO plan, it can still work across the country in non-emergency situations. But you always have emergency worldwide coverage as well. So these plans have to at least meet the minimum standards that original Medicare offers, but they can go above and beyond those benefits. So all those Medicare commercials and mail that you see that says, I called and got more benefits. I got such and such and such when I called this number. You may be entitled to more benefits. Get money back into your Social Security check. Dental, vision, hearing, transportation. The list goes on and on. I hear it all the time. And I'm not even on Medicare. So these are all those extra benefits that can come with a Medicare Advantage plan. Because they're managed through a private insurance company and they're in a competitive market, plans can pretty much do whatever they want to add extra benefits to help you in your health. And it's pretty great. It's great. And these plans can be as low as $0 a month. Because Medicare is sending the company money that they would have otherwise used on you, to manage the plan, a $0 premium is basically them just saying, oh, we're getting enough from Medicare. We don't need any more premium to administer the plan. So $0 plans are not too good to be true. However, these plans are based on what county you live in because, let's face it, insurance companies, they don't contract with all the providers out there. And so if they don't have providers in your county, unfortunately, you may not be able to sign up for a plan with them. And so these plans are based on what county you live in, and that's why those commercials ask for your zip code, is to know if there are Advantage plans available to you there. Last but not least, ancillary supplemental coverage. This may or may not be necessary to your situation, but just so you know that it's out there, there are things such as hospital indemnity plans, which is a little policy that can help cover your copays for your hospital stays. So you can have no copay at all if you're in the hospital for 5 days. Not a bad deal. Dental, vision, hearing plans. Most Medicare Advantage plans have dental and vision, and hearing built into it. However, there still is options outside of your Advantage plan to get dental, vision, and hearing, especially if you choose to go with the Medigap plan, which typically does not cover those things at all. Again, unless it's medically necessary. Their sole purpose is to pick up the 20% that Medicare normally does not cover. Now, there's short-term, long-term disability coverage, which is there to help, replace your income should you become disabled. Cancer, heart attack, and stroke insurance, again, helps pay for those things should you come across or succumb to any of those conditions, and critical illness insurance as well. All things to help pay for your health costs in addition to what your insurance covers. So this concludes lesson 2 of the Medicare Masterclass, kind of going over more of the supplemental options available to you. In the next lesson, we're diving more into the Medicare Advantage plans because I may have mentioned that they are more regulated, they have more rules involved, and there's a lot more to understand. So we're going to spend more time diving into the Medicare Advantage plans with this next lesson. Look forward to seeing you there.